Good day, everyone. My name is DAKKSHAN. I am from group number 25, and today I'm going to present to you about the signs and symptoms of pulmonary disorders and also inadequate breathing to report to the nurse. Now, before we get into the signs and symptoms, I would like to explain to you what a pulmonary disorder actually is. So, a pulmonary disorder is actually any disease or lung problem that causes the lung to not function properly. It can also be something that is caused by an obstruction in the airflow from the lungs, and also the symptoms could be as simple as breathing difficulty, cough, mucus, and production of sputum, and also wheezing. Now, the symptoms that I've just explained are just the common symptoms that most of us already know. But what are the symptoms? What are the signs and what are the symptoms that we should report to a nurse if we do happen to come across this while monitoring the patient? Well, let's get right into it.
The normal respiratory rate of a patient should be 12 to 16 breaths per minute. Therefore, if the respiratory rate falls below 12 or above 20, then we should report it to the nurse. That can be reported to the nurse immediately is when the patient is having shortness of breath, also known as dyspnea. When the patient is gasping for breath, it means he is having difficulty in breathing. Therefore, we should report it to the nurse as soon as we notice this change in the patient. You will also have to monitor the color of the patient's skin or certain parts of his body. So, if it starts to turn bluish, it means the patient might have developed cyanosis. Why does this occur? This is because the patient's blood is low in oxygen, and it causes the color of the skin to turn a little bluish. This sign should always be reported to the nurse immediately. If the patient has retractions, it means that it is a sign that someone is working hard to breathe. He could be having difficulty in breathing, so this is a sign that you should report to the nurse as soon as you notice it. Should be monitored is when the patient has noisy, labored, and irregular respiration. Also, it could mean when the patient is wheezing. This sign should always be reported to the nurse immediately. Take into account is the capillary refilling time. Now, if it takes more than 3 seconds, then the signs are alarming. This could indicate that the patient is having dehydration, and it could lead to more substantial consequences. Therefore, we have to inform the nurse as soon as possible. We have to monitor the pulse oximeter value of the patient. If it drops below 95, it means the oxygen concentration inside this patient is starting to decrease. And the lower it goes, the more dangerous it becomes. Therefore, it has to be reported to the nurse. The signs and symptoms of inadequate breathing, we should always monitor the movement in the chest of the patient, whether it is absent, minimal, or irregular. If any of these happen, then we should report it to the nurse. We should monitor is whether coughing is present in the patient. We should notice whether the coughing is productive or non-productive. Productive as in if there is secretion, and non-productive if there is no secretion. We should always report this to the nurse. We will have to inform the nurse if there is nasal flaring in the patient. Nasal flaring is when the nostrils widen. This indicates that the patient is having difficulty in breathing.